Hey everyone, it's Dr. Rick. Monica had a question about headache and exercise. Monica's specific was headache after exercise, 2 hours, usually when the temperature reaches a certain degree high. So if this is the first time you're finding me, don't forget to hit subscribe button down below and then the alert button to find out when I do new videos for the question of the day. So headaches are so ubiquitous with everybody, kids, old folks, middle age. So the idea, I thought I'd break it down this way. First off, if you have a headache and it's new and you want to exercise and you're 40 years or older, please get that worked up first. I mean, if it's a mild headache, it's not a big deal, I guess, but there's two things with medicine that we really don't mess around with. Number one, unusual headaches. Number two, unusual chest pain, especially if you have high risk. So call your doctor, hopefully he's available, or get to an immediate care center. Anyway, so let's break it down into the common causes of headache, and maybe you guys will be more empowered to decide what to do as far as asking your doc or just observing. The biggest things, if you look at what happens with the head, is just like my tutorial on abdominal pain. There's so many things that it could be that we just break it down into what makes up the head. So you've got blood vessels, you have bone, you have muscle. I forgot to put nerve tissue there too. So nerve tissue would be the big brain and its small dendrites and axons, nerve tissue. Then blood vessels that feed that nerve tissue. You have a lot of blood vessels coursing throughout the tissues of the brain. Then you have bone, the skull, and you have muscle on top of the skull. Skin is there too. We'll include skin and muscle as the same entity. So those are the four biggies. If it is nerve tissue, that's not good. It could be a tumor, could be a headache caused by a seizure that's coming on. I'm talking about the worst case scenarios, okay? And or other problems like pushing on the brain tissue from a neighboring blood vessel. So that brings us into blood vessels. Blood vessels are usually there to feed blood, oxygen, to brain tissue, so brain tissue will work. Now the problem is blood vessels are very intricate and they course right through the brain tissue. Brain tissue is very sensitive. So a blood vessel can expand and contract depending on the hormones and the demand by the local tissue. So in some cases when the brain tissue is working okay, but the blood vessel decides to open up, even that fraction of a millimeter that it opens a little bit, it pushes on brain tissue. That can happen when the blood vessel just decides to spasm open and closed. That's a migraine usually. Sometimes blood vessels can do that from high blood pressure. A high blood pressure front coming off of the heart will expand the blood vessels. It'll cause a problem with pushing on the brain tissue, neighboring brain tissue to the blood vessel. That'll cause a headache. So, and the blood vessel itself has nerve endings in it. So that can cause, the stretch receptors in the blood vessel can sometimes cause referred pain too, or a kind of pain. And then there's bone, obviously a fracture, bone infection, osteomyelitis, bone bruise, like a concussion. I didn't mention concussion as far as the brain tissue, but that's usually a bruise on the brain tissue in addition to a bruise on the blood vessel. But you can also have a bruise on the bone from concussion. And then there's muscle on the outside. Muscle can spasm, especially this muscle here, temporalis muscle. It can spasm from inherited disorders, blood vessels on the outside, temporal arteritis, it's an inherited disorder, or a chewing problem, a problem with TMJ. When you have a temporomandibular joint problem here, the muscles on top of the skull have to control that, and when you have to overuse the muscles, just like a calf cramp if you're doing a lot of steps, the muscles here will spasm and cause pain. So that's the four basics. The most acute, the most important would be make sure there's no stroke. So stroke is usually a blood vessel issue. So when you have a blood vessel issue that's leaking, that's a stroke, hemorrhagic stroke. Blood vessels aren't supposed to leak. When you have a blood vessel that has a little bubble on it, like a bubble on a tire, that's called an aneurysm. Sometimes bubbles are super tiny. You won't notice them on a regular MRI or CT scan. And then when your blood pressure gets to be elevated, it again, no matter what the reason for the blood pressure being elevated, the heart pumping harder or too much sodium in your diet, the bubble will get bigger. Kind of like if you've ever had a bubble on an old tire on your bike. If you overfill the bike tire with air, the bubble gets bigger and it pops. It's a weak part. Well, same thing with the blood vessels in the brain. If there's a tiny Barry aneurysm there, a little bubble, and the overall systemic pressure is high, that weak part will expand. It might get some clotted blood in it, or it just might rip open. So the ripping open part, that's again, blood. It leaks out from the blood vessel system into the brain tissue. That's not good, because pressure of blood vessel versus brain tissue, the pressure of the blood vessel will win, and it'll cause damage to the neighboring tissues because of the leaking of the blood. Blood's irritating, then you don't have any blood flow, and that's a stroke. You can also have a stroke where the blood vessel gets clogged off. So how does a clogged off blood vessel occur? Well, remember, you're supposed to get blood flow and oxygen to this vital tissue up here. When you don't get any blood flow, like when you're choked off, you pass out, not enough oxygen. Well, sometimes what happens is if you have the atrial fibrillation or you have a blood clot that's forming in the heart, it can sometimes snake its way through and end up in the tiny blood vessels of the brain. And any part of the brain after that blood clot chokes off the blood vessel will not get oxygen. That's an ischemic stroke. So that's not good either. So that's why if you have something new, if you have some high risks, history in the family, high blood pressure, blood vessel disease, you probably should get that worked up. So in the case of a young person with headache, maybe from exercise, we're not too worried. Kind of depends. If you have blurred vision with high blood pressure and a headache, it could be a problem. Blurred vision itself without a headache, not a big deal. Sometimes the eyes, that's why I put a secondary column here, the eyes, if you're constantly going like this because you can't see, that's what happens when you can't focus. If you have a problem with focusing and you're going like this, it could be that the muscles around the eyes are causing the headache. That's referred pain. There'll be an eye problem, but you can have pain back here. It could also be that the part of the brain that takes care of vision, takes care of interpreting the environment that's being seen by the eyes, is back here, the occiput. That could be a stroke too. Again, it all depends on the associated symptoms. So if you have a vision problem, then it could cause muscle pain to the skull and the scalp and cause pain. If you have a true glaucoma issue, like high pressure in the eyes, that can cause pain from these two organs called the eyes, and you have to see a doctor to get the pressure level checked. Obviously, the muscles in the eyes also, there's muscles back here that control your movement. They can be a problem too, like in Graves' disease, but it's low yield. Cervical pain can also be transferred to the skull. So if you have an impingement, like our chiropractors usually take very good care of, the impingement of the nerves or the cervical spine can cause pain around to the front. Depending on what level of the 7 cervical spines the nerve is being pinched, you can kind of determine the referred pain to the area that nerve takes care of. Each nerve that comes off each level of the spine feeds a different area of the body, and you can kind of determine if the area is over here, you figure out it's probably back in the cervical spine. Also sinuses. There's 2 maxillaries, there's 2 frontals, there's 2 ethmoids, and there's 2 sphenoids. And the sinuses, or empty caves in the skull, they are lined with mucus producing cells and sometimes pressure in the sinus, especially the nose is blocked up and the sinus can't drain out. That'll cause pressure too. An infection in the sinus can cause pressure too. It can be here, to the teeth. Again, there's classical ways that all these things cause headache, but you don't have to follow all the rules to that classical distribution. Bottom line is we always have to worry about the big guys first and work our way down. That's the way medicine works. I also put here chemicals and hormones. Sometimes as you're going through menopause or low testosterone, you can also develop headaches. But the hormone waves and the changes, they usually independently don't cause headache. They affect these things, usually the blood vessels, and cause headache. Chemicals, definitely irritating chemicals. Ammonia can cause a headache. Chemicals like caffeine, that can cause a headache, but again, it's usually because of problems with affecting the blood vessels. So that's why history taking is very important. So that, in a nutshell, will tell you tell the practitioner where we should be focusing. It also determines, it's also important to find out what the medical problems are with you. What are the circumstances surrounding the headache? If you have a headache and it's 2 hours after exercise, it's only when it's hot. My thinking is that usually with an elevated temperature, most people will sweat more. If you sweat more, the deduction would be that there's a change in your chemicals, sodium, potassium, magnesium, and sometimes when there is a change, blood vessels might not work properly, because blood vessels are muscle, and muscle depends on magnesium, sodium, potassium. There's a sodium potassium pump that's important there, so that can cause a spasm or poor functioning. Also, brain tissue that I didn't put here, nerve tissue. Nerve tissue depends on the same sodium potassium pump. So if you have a change in sodium content because you say sweated, I'm just assuming this now, it can cause the tissue to have the sensation of pain. So that's where I'd leave it, but whenever there's worrisome, like a rapid onset, whenever there's escalating pain, it started out one day as a 4, and then it's escalating now to a 10. When you have pain, it's 2 hours after exercise, and now it's with exercise, and then it happens even without exercise. Those are ascending or escalating problems, and those warrant fast workup. The usual workup is going to be first physical exam, blood tests to see if you have blood vessel problems, sedimentation rates, autoimmune test panels, rheumatoid panels. Sometimes we'll check magnesium, potassium, sodium, electrolytes. And then comes the CT scans with or without contrast. MRI is really sensitive. I love MRI, MRA. MRI kind of takes a magnetic picture of the tissue. It looks for big, obvious problems. But sometimes, as I mentioned, the aneurysms are very tiny, and they're blood vessels that usually aren't well delineated on a CT scan standard, non-contrast, or an MRI non-contrast. So there's a way to light up the tissue with an MRI in addition to the blood vessels. So sometimes it's more sensitive for finding a small aneurysm that's developing. So aside from that, there are EEGs that neurologists use for seizure determination. The chiropractors can sometimes manipulate and say if it's very conservative and you just have a manipulation. I had that with my chiropractor, Dr. Alan Getz, in South Elgin, and helped me get to the Spartan run because I was suffering from a headache. It was actually on this side. Took care of me, got through the Spartan run, no more headache. Actually took care of my fibromyalgia trigger point, and great. So if you have a little bit of a problem, low risk, and you can't afford MRI, MRA, CT scan, doctor, sometimes chiropractor, a cheap way around it is you get a manipulation. If the manipulation helps, then you know it's probably back here. So that means the level of acuity goes down. If it doesn't help, again, you have to kind of sift through and get some help there. Massage therapy, just as good too. Trigger points of muscle, say trapezius, can throw pain frontward over the frontalis muscle. It's called referred pain. Travell's points, a lady that I think she was in Eisenhower's era, she found out there's a referred pain that can happen from a distant point. So that's where a massage therapist, a good trigger point massage therapist, will be able to figure that one out. So these are the common things. So Monica, good question. We're going to work this up. If anybody else has any questions, put them down below. Otherwise, I appreciate your subscriptions and your watching. See you in the next clinic.